Hi, I'm Jacqueline, and I have scoliosis, and I am in a world of pain right now. I just wanted to create this video for you guys. I know a lot of people are out there with scoliosis issues, and I know there are people with surgeries that you might be having. I've looked on the internet a lot. In the past, I had cervical arthroplasty a couple years ago after a car accident, and I looked on the internet for a video of somebody maybe having had it to just kind of see what an example of like somebody's experience was. And so I decided to create this video and a few more of kind of like what I'm going to go through, because maybe there's other people that are going to experience something similar. When I was 15, I had scoliosis surgery to correct a 49-degree curve. I had an S curve, which I still do. Nowadays, they have this amazing surgery where they basically like straighten you up. And I wish I'd been born a little later, but God puts us in our time when we're here, and I'm here for now. So, but I had the Harrington rods, which were stainless steel rods, and they no longer do those any longer. That's horrible grammar, as my husband and I say. Editor, sorry. So I had two Harrington rods put in and some screws, and forgive me, I think it's like T8 to L4 or something is my levels that I had done. I'll show you a picture here on the screen of my my prior and then my after of what they did. And then fast forward, I had a lot of arthritic pain early on, like when I was 19. I remember seeing a doctor and he's like, oh yeah, you already have degenerative arthritis. Well, my great-grandma or my grandma, I think my dad's mom had degenerative arthritis, and she didn't really do well with that. So I was a little freaked out about that. And so, however, with scoliosis, all of us know when you have surgery, you have some degenerative changes because of that, and you have arthritic issues. And so all that being said, I was having a lot of pain. I was on Celebrex when I was like 19, and then I was married at the time, and it was a really abusive relationship mentally and verbally. So needless to say, I was in a lot of pain. And after going through divorce, the arthritic pain actually subsided. And side note, I feel like sometimes our bodies absorb a lot more from the outside world than we realize. Stress, obviously, we know that happens with hearts and things like that. But a lot of that actually did decrease afterwards. I would notice, living in Texas, I noticed that my hips would hurt really bad when we'd have like cold and wet weather. I live in a really dry and cold state during the winter, which is really helpful. Like, I don't have the arthritic pain, but I have since, in the last 4 years or so, started having really bad sciatic pain. Piriformis, whatever it might have been or might be, whatever. And so I started having, had a really bad stint of sciatic pain for about, I think it was about 6 months. And I had started a new job, and I was noticing just standing up would create some really intense, horrible pain. It was on my right side. And I remember having to go to training, and I had to squat at these different tables. We were doing some different training at a convention center, and I had to, or a convention thing, and I had to squat just to relieve the pain. It was so bad. And I did massage therapy, I did chiropractic work, and nothing really was helping. Eventually it did subside, but I don't really remember a certain one thing that helped. It just kind of calmed down finally. Then I had it on the opposite leg, and so I started seeing a PT guy at that time. I had gotten an MRI. I was having minimal, just scoliosis issues, degenerative changes. They'd noticed some sacroiliac arthritic arthritic stuff in my lower or in my SI joints. And also, in 2019, I was in a car accident and had to have cervical arthroplasty done, which, side note, if anyone has to consider that and you're a candidate for that for your cervical spine, go for it, because it was freaking amazing. The recovery time was fantastic. It was like a week, and I was moving again. You don't even have to wear a collar. It was just amazing, and the movement range that I have is like amazing. I wish that that was an option for the lower spine and not fusion, but we're not quite there yet. And kind of like Harrington rods of the past with the stainless steel versus titanium, and the new scoliosis surgeries that basically like straighten a person up. It wasn't that way when we were younger. So, anyhow, I had my cervical arthroplasty done, and even the arthritic pain that I would get occasionally in my neck was gone. So that was a freaking amazing. They use the Mobi-C devices, so if you ever have to have that and you're a candidate, I totally recommend it. So for me, it was great, and the recovery time was great, and the movement that I still have is great, and the pain, less pain that I have now is amazing. I had horrible feeling in my hands after the accident, because I had bulging discs and things like that. So then when I had my accident, they had noticed a crack in my rods, which a lot of people can have that with scoliosis surgeries and may not necessarily be a problem, but my current doctor noticed that there is no healing happening around that, so he was kind of concerned with that. So I've had that issue. Then when I was having the sciatica on my left leg, I started seeing another PT. This time we did the McKenzie method, which was really helpful after having this pain for a while, and then switching to this PT guy. We tried the McKenzie method where you basically like lay like a seal on your belly and you lift up your arms, like you're pushing up, and somebody else presses on your lower back like against you, and doing that like multiple times over several days, or by yourself and pulling a towel against you while you're leaning back. That actually started to relieve that sciatica flare up. So that second time, within like a weekend, my pain went from like a 10 to like a 2 or a 3. So that took care of it that time. Then I had it again, like a 4-month stint. And this time, I kept having it, trying the McKenzie method. Nothing was working. I had even done 2 epidurals in my lower back, and or one, I believe it was. Nothing had touched it. So my husband and I, we were going out to the mountains to celebrate our 1-year anniversary, and I had put my Spanx on for the day, and I was in a lot of pain, but I wanted to do this. And that following day, my pain was gone. And so somehow the compression of that back area, either creating some extra blood flow or pushing on the nerve or pushing on the muscles, relieving something. My PT people didn't really know exactly what was happening, but somehow that relieved the pain from months that I was having. So then I'd kind of wear it throughout the rest of the week to try and lessen it. And then it finally did get relieved. But I always kind of had this like tinge of sciatic pain, mostly now in my left leg. So fast forward to about a year ago, I noticed we were standing outside for an extended amount of time, and my left leg started feeling like it was just going numb and just about to give out. And so it was really concerning, and it happened a couple of times, and then it didn't really bother me too much over the next year, just occasionally, until it got really bad to where it was happening all the time when I was standing up or when I was walking. So I reached out to my doctor again, and we did another MRI, and it turned out that my 4-5, I believe it is completely diffuse. So it's like the great videos on Instagram or TikTok where they like take the putty or whatever, and they take that little like cylinder and it smashes it and it goes everywhere. So my disc is now everywhere, all around. And I have now spinal stenosis on my left side. So not only is my disc getting in the way, but that opening is no longer big enough for my nerve to get through without being constricted. So we found that. So I got referred to another doctor, Dr. Jamrich in Denver, to talk about the possibility of redoing my my back entirely. I had scoliosis surgery when I was 15, and it was a 49-degree curve. Dr. I can't remember, Dr. Jackson, I can't remember, I'll think about it. In Houston, did my surgery. We put two stainless steel Harrington rods in my back with the hardware, and about a week later, I started feeling really bad, wasn't feeling great, and my mom and dad called the nurse. She said, oh, it's flu time, she's probably got the flu, which is like, you never say that to a patient who's just had surgery. If they're running a fever, it's an infection. So laid in the bed for another week until my birthday, which was Christmas Day, and my back just exploded and bled and infection everywhere. So called the ambulance. They came and got me, took me to the hospital, squeezed it like a pimple. I know that's gross, and I'm telling you this, so sorry for the grossness. But it was horrible pain, needless to say. They had to take me in for surgery that next day or later on that night, I believe it was, and clean out all the infection, and then sew me back up. So they left the rods and everything in. Then they put me on they put a PICC line in for 6 weeks, and I had to do twice a day antibiotics. Had to have it cleaned every week, and then I was on antibiotics for 6 months, so to treat for a staph infection. So, excuse me. So then, after they did that, I got better. Was walking, like 2 to 3 miles a day. Didn't really feel like I was limited too much. I did a lot of stuff in my growing up. I rode horses occasionally. I went snowboarding, skiing. I used to remember them saying, don't ever do back bends, and I did those on occasion, which, stupid child, I guess just to see what I could do. But maybe that may have not helped with the crack in my rod. But anyhow, so I felt like it was a decent thing, but my posture was not completely corrected, and I still had a leg discrepancy, which I only got fixed last year by putting orthotics in, which really helped with hip pain. I was like a centimeter off, I believe. I think something like that. So I went to Dardanos. If you have a Dardanos, they're great for adding a lift in your shoe, which Birkenstocks were the bomb. I bought like 3 pairs and had them all put a lift in one side. Now, after my surgery, it'll probably change. But anyway, so had that experience growing up. So now, having gone back to the doctor with all of this extra pain, I met with Dr. Jamrich, who is a spinal surgeon who deals with deformed backs, people like me with scoliosis issues, and I'm sure other deformities. And we looked at it together, and because of that diffuse disc, he has decided he's going to pull that out, put a spacer in, and put a spacer in the disc below it as well. And then we've discovered that I knew I had bertolotti syndrome, or Bertolli syndrome. Basically, the lower bones on your spine, the left one is starting to fuse with my sacrum. And so if that does fuse and then at some point it breaks apart, the pain would be enormous. So he's going to fuse that very bottom level as well, I believe with a spacer, and then he's going to put screws into the hips from the spine to keep that in place so that never breaks apart. It's a really crappy thing to deal with that bertolotti, whatever, pasta sauce syndrome that I have. So we'll have to do that. And then he's going to take out the rods and he's going to replace it with a titanium rod and clean up some of that area that is left over, you know, all where all my bones are from the fusion originally. So that's the plan with my surgery. So I feel like I'm going to get a lot of relief. I have been living on this couch for the last 3 weeks. My pain is literally at a 12 out of 10, a 1 to 10. I had natural childbirth, and this is nothing compared to it. Currently, I'm sitting on a heating pad, which is the only thing that helps. And I am in probably about a 5 right now. I'm trying not to move a lot. My leg is constantly going numb, along with the most excruciating pain. I would like to amputate my leg most days. My ankle hurts a lot as well, even when I'm laying down, just that same nervy pain. It starts from like my real low back and it goes all the way down to the bottom of my soles of my feet. If I stand up for a very limited amount of time, the nerves just start to be on fire, and the pain is excruciating to where I lay down and I will yell and scream for a while and cry until it's calmed down. Because usually laying straight on, like laying flat on the couch on the heating pad is usually what will kind of bring it back down to a baseline. Sitting up is pretty painful as well. It depends on if I've laid down for a while and then I sit up, it usually is okay. But if I am walking around and then I sit down, it is not okay. So I don't know that I have experienced anything like this, and I'm sure that other people are probably have experienced similar pain problems like this too. So just kind of give you an idea of like why I'm having the surgery and what the reasoning is behind it, if you're experiencing similar things, and maybe it'll help you if you have scoliosis issues or whatever. I do know, everyone's like, have you tried the chiropractor? I used to use the chiropractor a lot. I don't know if they possibly added to that crack or caused the crack in my rods. Now at this point, I don't think I would recommend chiropractors to scoliosis patients, just because I've seen what has happened to my rods, and I don't know that that's the safest thing. I think that chiropractic care can be great for people with typical spines, but with hardware connecting things and them shifting things, I don't know how safe that is. So I would just use caution, maybe talk to your regular doctor first. I tried, when I had my cervical spine surgery, I tried gabapentin, and it caused me to gain 30 pounds, and I won't do that again because it didn't do it did nothing for my arm. I had the worst pain in my arm as well. Not like this pain, but it was very painful, and it did nothing to relieve the nerve pain, so I didn't want to take that route again. I've tried muscle relaxers because my massage therapist has said she thinks that my piriformis is tight and maybe causing the issues with my sciatic nerve. The muscle relaxers have done absolutely nothing. So I've tried pain medicine, actually I haven't. I've done Tylenol and ibuprofen, which I have to be very limited on ibuprofen because of kidney issues. And they pretty much just kind of take a very, very small edge off. So I'm pretty much unmedicated, only on a heating pad to help with my pain. And this is probably the worst experience in my life. So I feel for you all. If you're experiencing this, I am praying for you, and I hope that you find some kind of relief. I know that the injections for me, it actually made it worse. They were going in with the injection, and I felt the nerve hit like unbelievably, and the doctor said I'm not even close to your nerve yet. And so I don't even know what that was about. Who knows with all the scoliosis crap. So we're like a totally different breed of people. And, my doctors think there could be a possibility with Ehlers-Danlos, which keeps my body from being really strong in the core. Everything's so lax and moving. So it's like I can't find a regimen that would work. And so there's no like, oh, try this, try Pilates, try this, use these. I use all my PT exercises, and it's just not a sure thing. And the only sure thing I have right now is my heating pad, which I just had one die on me yesterday, which sucks. But anyway, enough rambling. So I just wanted to put this out there for anyone. If you want to ask me questions about my journey or what I've had to do with mine, or who I'm seeing, my doctor or whatever, let me know and I'll be happy to answer any questions. I haven't gotten my surgery date yet. We're still getting insurance approval, which was supposed to happen today, which should have happened like a week ago based on my calculations, and I am just dying, literally. And having 4 kids is really difficult when you can't get up and move around and help, and this is just awful. So I hope my awful experience can help somebody out there, figure out something for you, or just give you the feeling that somebody else is experiencing something as awful, and to know that you're not alone, and maybe there's some kind of answer or fix for you too. So I hope you have a great day and happy Valentine's Day, and I'll be back with some updates.